Royal Melbourne Hospital, Con speaking. Okay.
At the Royal Melbourne Hospital, nurse Con Alexandro and Dr Nicola Walsham take a call from paramedics rushing in a man who's been attacked and could be bleeding to death.
We're currently loaded with a male who's just been stabbed in the right flank. Uncontrolled hemorrhage to that right flank.
Nikki, were you going to alert it or call it?
Dr Nicola will assist emergency Dr Maya Cubit, who now takes the lead.
All we know is ongoing bleeding with stab wounds. That'll be somewhere between the chest and the abdomen. It's unclear which. Okay, all right.
When he rolls into the bay, all I'm seeing is a paramedic who is very concerned that his patient has got significant ongoing bleeding, and he's doing his best to stem that with his hand.
Can I just stop? Should we move him at all, guys? Let's just move him on the AV trolley and move ours out of the way for a minute and see if we can get a pulse. If he's that precarious in terms of blood pressure and in terms of hemorrhage control, I'd like to try not to move him until we've established what we're going to do next.
He looks really unwell. He's clearly dying, and it's clearly because he's losing a significant amount of blood.
So my goal in the first 5 minutes is to just see if he's got a pulse and a blood pressure and start pre-oxygenating him. Yeah.
All we can do is to try to stop the bleeding and buy ourselves some time to get the patient to an operating theatre.
So guys, I just want to have an A, B and C, and then we'll make a decision as to whether we'll try and get him across to the other bed.
Dr Nicola keeps her hand pressed against the stab wound, with blood still gushing out.
Have we got anybody from anaesthetics?
He's got a hole in a part of his blood system where he's losing the blood from. He's not got enough left to maintain his normal physiology. And what we are going to do is to put some in to try and replace what he's losing, hopefully as fast as he's losing it, but with the long-term game to stopping what's coming out. Because ultimately, if we can't stop it coming out, it doesn't matter how much we put in, he will die.
Emergency Dr Emma West heads upstairs for a quick break to meet a four-legged friend.
Oh my God. So Royal Melbourne Emergency has a wellbeing initiative where we have a Bring Your Dog to Work program. Hey, come on.
Today, Boxer Milo is here to help staff relax away from the front line.
I'm used to having dogs around. My family has a dog. We have Marley the Labradoodle, and he's completely beautiful. We acknowledge we work in a very stressful and chaotic environment, and this brings us a smile, and that's so important to staff wellbeing. So you really just want a dog that's got a nice nature, which Milo does. Am I allowed to bring Marley to work?
Yeah.
He does like cuddles.
Yeah, and he's absolutely welcome because the staff love to cuddle.
Okay.
After a short break with Milo, Dr Emma is called to the ED, where an elderly woman is critically injured after being in a serious car crash.
Hi, my name's Emma.
Hi, Emma.
What's your name?
Vivian.
You've been in a car accident. You poor darling.
I got very bad pain.
Yeah, I wonder if you might have broken the little bone in there. As I walk into Resus 3 and meet the patient in front of me, I notice that she's actually very injured. She's in the later half of her life, and I'm already starting to get quite worried.
What do you need, Emma?
Senior emergency doctor Jonathan Papson steps in to lend a hand.
This lady is a trauma alert.
Yeah.
I just need an initial assessment.
Yeah, okay.
Yeah.
Come on. Today is particularly busy. There's patients all over the place. So when I walk in there, I'm a bit surprised to see someone so unwell with just a couple of people looking after her. So when I see that, I go, maybe they're going to need some extra help.
Now, the worst part for you at the moment is your chest. Vivian? Yeah?
That's a seatbelt.
Yeah, or possible sternum. So airbags went off, did go up, yeah?
Yeah.
Yeah, okay, alrighty.
Yeah.
Vivian has a significant amount of bruising and abrasions around her right eye. We do know that patients that are hit in the eye can lose their sight. She's got cuts all over her face, her arms and her legs, but it's really the injuries to her chest that I'm worried about.
Oh, you're very bruised, aren't you? Gee. Yeah, all right.
Oh, hello, it's Emma West. I'm going to order a chest and pelvis x-ray, and could I have it as soon as you can in Resus 3, please? Thank you, bye.
To find out just what happened to the 75-year-old grandmother, Dr Jonathan talks to the police officer who attended the accident scene.
Someone's hit her.
Yeah,
head on.
Cars hit her and then the trucks hit that as well.
in your...
Oh, when I breathe, yeah.
Vivian's got a seatbelt injury, so she's had so much force go through her chest. She's actually got skin tears and bruising. It's not just your regular kind of little bruise you see.
Your arm looks pretty sore as well, doesn't it?
I'm worried about injuries to her ribs and her breastbone. She also looks like she's got a head injury, which means she may also have a spinal injury to her neck and also her back. Because when you have such force go through your chest, you tend to break the bones in your back as well.
I can't lay down.
Any time on a good day?
No, I sleep on 2 pillows.
Yeah, sure, no worries, okay. As I tried to lay her back to listen to her chest, to assess her as we would for every trauma patient, it becomes immediately clear she's in far too much pain to lay back. It puts pressure on her chest and that suggests there's some kind of severe injury in the front part of her chest and she just can't lie down at all.
Where's it hurting when you breathe?
Yeah,
in the middle of your chest.
In a little while, it may get harder and harder for her to breathe because it hurts to breathe and her lungs aren't very good to start with. So she may tire of breathing and actually stop breathing at some point. We might have to take over and put her on life support.
So are we going to roll across or just pull across?
In Trauma 1, a 45-year-old stabbing victim is barely hanging on to life.
On my count, 1, 2, 3.
This man will die if we don't stop the bleeding that we can see and figure out where the bleeding is coming from.
And who's here from surgery?
It's a frantic day in the ED, and Dr. Meyer needs backup from trauma specialists.
Can I just get somebody to make sure a trauma call has gone out?
So my job as the team leader is to say to myself, what is killing this patient and what am I going to do about it?
So Laura, can you make sure you've looked for all of the other hiding holes for stab wounds? Thank you.
So what we'd like to do is to say to ourselves, can we stop the bleeding here in the emergency bay?
So he's had 2 units of cut red cells and 1 unit of FFP is running now.
The team pumps the man with blood, which is the only way to keep him alive while he's bleeding.
So Alex is doing an outline on the left, Dan's doing a RIC line on the right, Amy's got airway, Nikki's on hemorrhage control. We will see if we can get stable enough to try and get a CT scan. And we might need some pain relief as well.
We need some idea of whether it's in his chest or his belly that the bleeding is coming from, because that helps the surgeon know which cavity to start with when they operate.
All right, guys, we've got a window here. It's a very precarious one. We're going to try and get to the CT scanner. Thank you for that recline. That's awesome, team.
With the man's life hanging by a thread, the team prepare to move him.
Okay, let's pack him up as though we're going to try and get to CT. Guys, we've got a window here.
There's a sweet spot somewhere in there that is, I think this patient will survive a CT scan and it's not going to cause too much harm in that I think it won't take too long and I think we'll be able to keep the patient alive during that process.
CT is ready and waiting. Thank you, Amy. All right, let's go.
There is never a guarantee to take a patient to the CT scanner. The CT scanner is called the donut of death in an emergency department. We're all really scared of taking our very, very sick patients into that room because sometimes they don't stay in the sweet spot. They deteriorate and sometimes they try to die.
Airway is what you see. She's got bilateral lung slide. She's got bruising all over her tummy.
In Resus 3, 75-year-old Vivian has serious injuries after her car collided with another vehicle.
Oh, how am I going to scan her?
Well, I think what we have to do...
Sitting up.
It's a freaking nightmare, the sort of injuries this poor lady has. Injuries to the chest, injuries to the soft tissues, probably broken ribs, probably a broken sternum, maybe a neck injury and a back injury. It's a disaster.
Does your son know you're here?
Yeah, he's on his way.
Okay.
The great-grandmother's family has been contacted and her son is rushing in.
I'm just going to have a quick chest x-ray for you, okay?
We need to analgesia and lay her flat. Because she might have T-spine fractures, right?
Vivian has a pre-existing lung disease and is frightened to lay down fully. But Dr. Emma and the team urgently need to take an X-ray.
I know, but I can't lay
What
flat.
happens?
I can't breathe.
Can't breathe. Okay, we will fashion a way. Okay.
Emma's a great clinician, and she's trying to talk Vivian around so that we can actually get her in a better position. And she's trying to get her to trust us.
And so I'm going to give you enough pain relief, and I'm going to be with you. I'm going to hold your hand, and we're going to work together. Can that go under the bed?
Only if she's lying down.
So you need...
Put it under.
Yeah, and can you do that?
Flat.
Yeah.
But if she's sitting like this,
You can lay me
put
flat.
it in.
No. Can you put it behind there then?
Yeah.
Yeah. No, I don't want you to move, Dale.
Dr. Emma has been caring for patients in the ED for 20 years. Her love of helping others began with her father's illness.
My dad was unwell as a 5-year-old, and he had a brain tumour and lost his sight. And he's really a kind man who's very compassionate, and he probably taught me to think about how other people are and other people's needs, and be more aware of, you know, what good you can do in the world around you, the immediate world around you, those people who might need a little bit extra help.
I think you need to lay her down and you need to give her the stuff, yeah, and she'll be all right.
All right, let's get the X-ray, and then we can analgese her and lay her down.
All right, I'll run away and let you know.
With such a busy day in the ED, Dr. Jonathan is needed elsewhere.
X-ray. Breathe in. Hold it there.
So good.
Yeah.
So no subcutaneous emphysema, no blood, although she's not lying flat. In the position that Vivian is in, X-rays are quite difficult to interpret. That's all right, I can fix that. I can't quite see if there are broken ribs or broken sternum. So really, the CT scan is the only way I will know if she's got severe chest injuries that could actually be life-threatening for her. I'm going to very gently lay you just a tiny bit.
Any pain in there?
Oh, no.
Thank you very much. I've got a pole for you over here, guys.
In the CT scanner, a stabbing victim is bleeding uncontrollably. Dr. Meyer has to pinpoint exactly where it's coming from, or the man will bleed to death.
You happy, Dan?
A CT scan doesn't save your life, but it certainly provides really valuable information for the surgeon. Where am I going to operate? Which bit am I going to open? What am I trying to fix here? And to go in blind with no information at all is really hard for a surgeon.
So it's not renal at all.
I think renal's okay.
The CT scan shows that this patient has a large amount of blood in his abdomen. The only injury that we can find is an artery on the side of his chest wall. It's called an intercostal artery. It sits just below your rib, and presumably a knife has lacerated that.
Have you guys got what you need?
I think we've got what we need here.
Yes?
We don't allow scans.
The knife has also penetrated into his abdominal cavity and created a tract that blood has gone through and into his abdomen.
All right, thanks for coming down.
But even a small artery, like an intercostal artery, can cause life-threatening bleeding, and clearly he's lost an enormous amount of blood.
I want a blood pressure above 90.
Dr. Meyer watches over the 45-year-old while surgeons get ready to operate.
Hi there, I'm Maya. What's your name?
2 busted knees,
You got 2 busted knees.
2 old stub wounds.
Yeah, okay, you've got a new one now.
Suddenly, there's a problem.
Okay, this is wet.
Blood is collecting so fast in his abdomen, it started seeping out through his back.
Nikki, he's bleeding all over the bed. My hand is wet. Everybody's disappeared. I need them to come back.
And the reason that it wasn't previously coming out was because he was tipped on his side, so it was going in. But when we laid him down and he spent time with ongoing bleeding, it was now coming out.
All right, I need to go to theatre. Is that the plan? Yeah, all right, let's roll.
We now know where this injury is. We know what needs to be done. We just need to fix it.
And have I got a bag valve mask?
And if we don't fix it quickly, he will die.
I'll put it in 20, so it's the same 1 and 1.
Emergency Dr. David Camilleri has been working at the Royal Melbourne for the past 10 years. 14 years ago, he left his home in Malta planning to spend just a year in Australia.
So if we take 2 meals, we're going to get 20 mics.
I took a job as a junior doctor in Cairns. They were an amazing bunch of doctors, made me realise how interesting emergency medicine was in Australia, and I decided I wanted to stay.
Okay. Yeah, no worries. Thanks.
I enjoy it a lot, I must say. Sometimes I tell my non-medical friends that I sound a bit nerdy, but I do tend to miss it when I go on holiday after 2-3 weeks.
You coming or is Tom coming?
I like either to run from work, it makes it literally I'm running away from work, or I actually run into work. I find a bit of endorphin rush, but it also sort of clears my mind before going to work.
On the rooftop, air ambulance is touching down with Dr. David's next trauma case. A 55-year-old mountain bike rider who's been critically injured. Downstairs in emergency, Dr. David and his team prepare for the patient, who was competing in a 100-kilometre race.
Look at the ceilings. People ask you questions, don't turn the edge off and just keep looking at the roof. Yeah.
He's been thrown off his mountain bike at speed. He's landed on his head. Worst case scenario would be that on arrival we might find that Brad is unable to move his arms and his legs, is having difficulty breathing. He could have a major injury to his spinal cord, so left with no function to his arms or to his legs.
Hello Bradley, I'm Abby, I'm one of the nurses, mate. I'm going to talk to you more after. We're just going to organise and get you onto the troll and talk to the ambulance officers, okay?
Thank you.
It's crucial to keep the former Ironman's head and neck totally still. The tiniest movement could cause further damage and paralysis.
Ready, set, go. He's been travelling on flat ground at speed, hit an obstacle. He's come off, flown over the handlebars and had a head-first impact into the ground.
Yep.
But he had immediate pain to his C-spine and his upper thoracic, intense paresthesia to the top of both shoulders.
Yep.
And he describes this sort of deep pain that radiates from his spine through almost to his anterior chest.
Yep.
Luckily, Brad was riding with mates when the accident happened. They're trying to contact his wife, who's a nurse.
Yeah.
Yep.
Yeah, that's it, right?
Dr. Kelly Rika performs initial checks assessing his injuries.
Bilateral pins and needles down both arms.
Yep.
And the left is worse than the right.
Brad, are they like shock waves down your arms or is it just like tingling, like ants?
No, it's like stings.
Like stings, all right. And it started straight after the event, hey?
Pretty much,
Yeah.
So the stinging obviously makes me worried about whether there is a spinal cord injury, but the nerves are not happy, whether there is any bleeding that might be irritating the spinal cord. It's a worry.
What we're going to be doing next, we're going to be putting on a slightly firmer collar on your neck, just to keep your head nice and still.
Yep.
And then we're going to roll you onto your side and have a good feel at your back.
Yep.
And then we're going to take you around for a scan, pretty much from top to bottom.
Oh, yeah.
Okay?
Yep.
1 second you're on a mountain bike and the next second you're on a bed told not to move. Trying to understand what's going through that person's head, the fear of not knowing what the next step is going to be or what is actually going to be found on those scans.
So when I push here? Here? Can you gently touch you here? Can you squeeze your bottom together for me? Great job.
Abby, you able to call CT for me? We'll see whether we can go.
Brad, a father of two, now has an agonising wait to find out the extent of his injuries. His active life may be about to change forever.
You're just going for a scan, sir.
The stinging, to me, that's a sign that there has been an injury. We need to image this patient and see whether we can find evidence of any bleeding or any injury to the spinal cord. We need to try and get to the bottom of it and figure out what is going on.
Push down against me. Push, push, push. Forward.
75-year-old car crash victim Vivian is still experiencing extreme chest pain. Vivian's been given strong pain medication, so Dr. Emma can recline the bed.
Being able to lay Vivian flat seems like a small thing, but it's actually a major achievement.
After you've done that bandage, we might just get a gram of
IV Panadol, because the sooner that's on board, the better. For Vivian, I cannot put her in a collar to immobilise her neck. She's too sore and too injured, and it immediately puts her at risk of not being able to breathe effectively. Thanks, Eliza. That's the Panadol, isn't it? So you've got some Panadol going in, and we're giving you that medication fentanyl, and they're all strong painkillers. How many kids do you have? 4?
2 girls and 2 boys.
Oh, perfect.
11 grandchildren.
11? Wow.
I'm just going to take a photo. Is that okay, hon?
Dr. Emma is also worried about terrible bruising around her eye and is sending images to a specialist.
I might just cover that eye a little bit, okay? Take that off and then let's just...
Whatever looks better.
You look lovely.
There's a chance that she has something called a retroorbital hematoma that's pushing her eye forward, and that's a major injury in trauma. So what I need to do is assess the pressure in her eye to see if she's at risk of losing her sight.
Hey, Mum. Hey, love.
How are you?
Vivian's son, Rhett, finally arrives.
Yeah, it doesn't matter. It doesn't matter about the accident, as long as you're all right.
Mum's been my rock since day one. Whether I'm good or bad, she always supports me. She's always been there for me. My whole world, mate. She's my queen, you know. I grew up with just Mum. I didn't have my dad around. My siblings, my 2 sisters and my brother are a lot older. So it was just me and Mum in the house all the time. I had cancer when I was 8 years old, and obviously from that, me and Mum just built an incredible bond, you know.
All right, next challenge is just getting you onto the CT table. I just feel so relieved that I'm now able to assess her fully by having a CT scan. So now we can get that important investigation that will tell us what's going on. Hold Eliza's hand. So she could have a head injury. She's certainly got an eye injury. On 3, 1, 2, 3. She could have a spinal injury, but it's her ribs and her sternum, the breastbone, that I'm most worried about. You've done it. You've got to the position.
You go in and out of the scanner a couple of times, okay?
We're looking at her spine there. There we go. Oh, so you can see all the bruising across here. I'm just looking for a broken bone underneath it. There's a fracture there on the left.
The results are not good. Once Vivian is brought back to the resus bay, Dr. Emma delivers the bad news.
So, I've just had a brief look through your scan and I can see sort of a buckle in your sternum. So, yeah, so that's going to be a challenge. Unfortunately for Vivian, she actually has some quite severe injuries. She has a broken sternum, so a fractured sternum, but also she has multiple broken ribs on both sides. And that is a major, severe chest injury for a 75-year-old woman. So I'm getting the intensive care doctors to come and meet you so that they know you. Yeah. And, you know, if they need to support you with your breathing, you know, they're on it early. Fortunately for Vivian's eye, she doesn't have pressure that is too high and it hasn't threatened her vision for the moment. If there's anywhere that you want her to be, you want her to be here, and we're going to do all that stuff early to do as much as we can for your mum. We know how important she is to you.
Vivian's son, Red, is relieved his mum's going to be okay, but knows she's in for tough times ahead.
She's as sharp as you like, isn't she? I think her body's letting her down and her mind's, you know, a mile ahead. She's charmed us anyway.
Yeah, Mum is independent. She's a wonderful lady. She's all about everybody else. She does a lot with her grandkids, and you know, my mum's a very sick lady, got chronic emphysema and a number of other illnesses, but she just soldiers on every day and does the best she can.
Can we stay here?
Yeah, you can stay here. Vivian is such a warm person. She's very clearly a committed mother and grandmother, and I think, you know, with her focus on her family, I think that attitude, and I hope that attitude will be enough to get her through this. I really hope so.
You know, it's trauma course, all of trauma and anaesthetics.
Emergency Dr. George Plunkett has been working in the Royal Melbourne's ED for 15 years.
Part of the reason I do ED is that it's always a new challenge every day. It's a new group of patients. Often I'm doing a slightly different job and no 2 days are the same. You know, I'm often working at different times of the day and I can see literally anything.
It's not long before Dr. George receives his first trauma call.
Good afternoon, it's Uncle Fire Truck. Got a 31-year-old female, 37 weeks gestation.
A young pregnant wwoman who's been in a horror accident is about to arrive.
Yeah, g'day George, you're on the ED consultants for Royal Melbourne Hospital. You're the obstetrics registrar on. So we've got a 31-year-old female who's 37 weeks pregnant. She's been involved in a high-speed motor vehicle accident. The problem we've got is that she's not felt any fetal movements since the accident some time ago.
Kelsey's partner has been notified and is on his way to be with her and their unborn child.
So do we want James and Tessa to have a look at the neonatal?
The doctors are trained in a situation like this to look after mum first and then we look after baby. Often the mothers want it to be the other way around. So Gavin on the airway, and I was going to get Caitlin to do our fast. Yep. Assuming that there is no fetal movement for an hour, that's a really bad sign. That makes me concerned in a significant abdominal trauma that there's been no fetal movements because the baby's deceased. So you'll start out doing a primary, you'll just loiter for the left-sided procedure.
With 2 lives that may need saving, Dr. George has called the obstetrics specialist from the Women's Hospital next door.
No fetal movements felt for some time now. So our main priority will be all about maternal resus. The main role for getting the obstetrician involved early is in case we either need to do resuscitative procedures on the mother, and often that can involve removing the baby immediately. So in the worst case scenario, if we've got a dead mother, then we've got dead baby as well.
Kelsey, my name's James. That's 1, 2, 3.
So this is Kelsey. This afternoon she's been involved in a 2-car MVA. She was the driver. She's wearing her seatbelt correctly, straight under the abdomen and across the chest. She's complaining of lower abdominal tenderness with no fetal movements felt.
Registrar Dr. Caitlin is looking for internal bleeding.
So the first thing we need to do is to look for serious injuries to Kelsey so that we can address those. So there's no fluid in the right upper quadrant. The car accident that she's been in at the speed she's been at with the baby at 37 weeks, that would absolutely be a potentially life-threatening situation.
Chest is clear, ankle air entry, and SAT's 96 somewhere in there. She's tachycardic, it's 125, she's got a good blood pressure, systolic 120. What we're going to do is do a CT scan of you from head to toe. The reason being is because your heart rate's so high, we want to make sure that there's no life-threatening injuries like bleeding to you.
If I was Kelsey, you would be worried about your health and your baby's health, but also then all of these people around you talking over you, talking about your pregnancy, your baby. I think it would absolutely be very, very overwhelming.
Did you hit your head, lose consciousness?
No, I don't think so. I'm just concerned about my baby.
I understand.
Kinds of things we're actually most worried about are injuries to that uterus, to that womb, that can really cause some precipitous troubles for bub. We're just getting that little bit of an ultrasound done. I'm less concerned so much about her going spontaneously into labour than I am more about her needing to have an emergency caesarean. You know, obviously in this particular case, with absence of movements, we're worried that baby's already had a very bad outcome.
My baby okay?
Is everyone ready for the roll?
In the CT, Dr. David Camilleri is worried Brad may have broken his neck as the 55-year-old father of 2 landed on his head when he came off his mountain bike.
Get you to relax your arms by your side to start with.
The stinging sensations Brad is experiencing may indicate severe spinal cord damage.
We'll be doing a scan of your head and your neck first.
There was a decent movement of that neck, which implies that spinal cord sitting in those vertebrae was definitely stretched and probably pushed and pulled more than it should, and which might explain then his symptoms.
Any obstruction to Brad's spinal cord could result in permanent paralysis. Brad's wife is a nurse at another hospital. She's just heard about her husband's accident and is on her way.
How's your pain at the moment?
Probably about
Intravenous painkillers are keeping Brad's pain at a manageable level. But his nerves are at an all-time high, waiting for results of the CT scan to his neck and spine.
So, Brad, I can see a tiny chip at the front, far from the canal. The main worry is when you have a fracture that pushes back into that canal where the spinal cord is, and I can't see anything doing that. So I think we'll be okay, but we're waiting for that full report to be certain, okay?
Thank you very much.
No worries. In the meantime, head nice and still, okay? Until we know exactly what's going on, all right?
The next probable steps for Bradley are going to be that he's going to be admitted under the trauma team, and then we're going to involve our orthopedic colleagues as well for them to give us their advice about the neck injury and whether anything else needs to be done.
Can you go around to CT and tell them we've got a trauma call?
Down the corridor, 37 weeks pregnant Kelsey still hasn't felt her baby move since she had a serious car crash.
Best thing we can do for Bub is make sure that you remain really well.
Dr. George and the team are desperately looking for signs of life in her unborn baby.
That's placenta.
Obstetric specialists have stepped in to assist Dr. Caitlin with ultrasound.
Baby's moving. We're just trying to get her heart rate at the moment.
Ultimately, this is about trying to do whatever we can to provide the least risky and the safest possible outcome for both Kelsey and her baby.
There's the heart there. It's just...
Finally, the sound everyone's been desperately hoping for.
Baby's heart rate, Kelsey, can you hear? Yeah. That sounds good.
The baby's beating heart. Enormous comfort to the young mum, still hoping her partner Joe is not far away.
There's always a great feeling of relief when you can see that a baby's moving, you can see a heartbeat. As a human looking after another human, you're absolutely happy for them.
What else do we need to get our patient to CT?
Knowing the baby is alive, Dr. George must now get Kelsey scanned for any internal injuries that could put her and her baby's life at risk.
We're going to need to do some CTs of you to try and make sure you remain well.
But with CT scans comes radiation.
People always get really worried. Radiation in my baby, is this going to be really bad? The baby's already potentially cooked. She's just growing and hanging out at the moment. People are always worried if I get radiation, my baby's going to get a birth defect. So I can't tell anybody receiving an X-ray or a CT, or for that matter, any medical intervention, that it's going to be risk-free. Yeah, radiation exposure does represent a cumulative risk, and so we try to minimise it where possible. Yeah, so we'll go to the CT.
With partner Joe still minutes away from the hospital, Kelsey continues to face the terrifying ordeal on her own.
37 weeks, how many days?
4 days, 5 days.
The obstetrics team returned to the women's hospital without having to perform an emergency caesarean.
Just like wear my seatbelt.
You've just decelerated into a seatbelt. It's going to hurt. And now their heart rate's 130. How much pain's the right amount of pain? I don't know. So we investigate further. I guess we could just sit in our hands and see what happens, but by the time something bad happens, it might be too late for the baby or potentially even for the mother. Just think, in a couple of weeks' time, you won't have to be sleeping on your side anymore.
No, well, Thursday I was booked in for a Caesar.
Thursday?
In CT, Kelsey is about to be scanned.
What's the bub's name going to be?
Polly.
Polly. Ready, set, go.
Dr. George is looking for injuries to the young mum and her unborn baby.
Your heart rate's 130 post a trauma after 90 minutes. That's not normal. You got a seatbelt sign on your neck, a seatbelt sign on your abdomen. So we do a CT and we're looking to try and exclude any nasty injuries to the mother. But even if the CT is normal and doesn't show us any injuries, that doesn't absolutely get us out of the woods yet. So we know in this group of patients that they can have significant injuries to the placenta or to the uterus that we're just not going to see on the CT, because if she were to have some of those injuries, well, then we'd need to intervene and perform an emergency Caesar and get the baby out of there. But fingers crossed it doesn't come to that. So we'll get you off the table onto a more comfy bed, get you back, and start doing some of that, CTG monitoring. We would at the very least be keeping her for a few hours and most likely overnight to keep an eye on things and make sure that she remains stable.
Partner Joe is finally here to comfort Kelsey.
This is my partner. Can he come in?
Yeah, follow it.
Kelsey's a great mum. She's amazing. I think about her every day. There's not a day goes by that I think about her. And all we want is to have a family and just have a normal life.
All right, Polly's okay.
Done the CT scans and we can't see any significant injuries to Kelsey or, thankfully to her baby either. So that's really reassuring information. So from here, the trauma team can touch base with her tomorrow to make sure that she's remained well overnight.
Kelsey and Joe share an enormous rush of relief. The worst is past.
Are you scared, Joe? I'm scared.
Dr. Meyer's patient came in with a stab wound to his side.
We will see if we can get stable enough to try and get a CT scan.
The stabbing victim was rushed to theatre, where surgeons successfully tied off his severed artery and closed the wound. He went home the following day. 75-year-old Vivian seriously injured her chest in a car accident.
I can't breathe.
Can't breathe, okay.
CT scans revealed a fractured sternum and 13 broken ribs.
She's scared. She really knows that she's severely unwell and she's worried that this could be, an illness that she dies from. But she doesn't want that. She just is so focused on getting better for her children.
Love ya.
I love you too.
You scared me there.
I know I did. I scared everybody.
It's been 3 months since Vivian's car accident.
But I'm all right now. I'm good. Brett's a good son. I don't know how I would manage those first 4 or 5 days in hospital without him.
Vivian spent 8 days in hospital and a further 9 days in rehab.
And the staff at the hospital are amazing. Can't thank them enough for what they've done for me.
Back home, Vivian continues to battle ongoing lung disease, but receives lots of support from her family.
Really, I am lucky. And I didn't realise how serious it was at first. I'm looking forward to spending time with my children, my grandchildren and my great-grandchildren. I want to go anywhere, I want to stay here.
31-year-old Kelsey was 37 weeks pregnant when she had a major car accident.
My baby okay?
Baby's heart rate, Kelsey, can you hear?
Yeah.
Okay, that sounds good.
Fortunately, CT scans didn't reveal any major internal injuries.
Yeah, the baby's moving and the baby's got a pulse, but we don't know what that baby's going to be delivered like.
Kelsey was transferred to the Royal Women's Hospital and closely monitored. Thankfully, a beautiful, healthy little girl was born 2 days later. Baby Polly is thriving, receiving lots of loving care from Mum Kelsey, Dad Joe and big sister Isla.
So we have Joe, myself, Isla, our 5-year-old. We have Polly, who's now 9 weeks old. And then we have our 2 dogs, Louie and Vega. Polly is perfect. She just is such a dream baby. 4 kilos of perfectness. Born she was. Isla is obsessed with Polly. Yeah, she's just the best big sister.
I feel very blessed that everything was okay and that we can all be here today. I think I'll be thankful every day I'm alive, I think.
She's, completed our family.
Dr. David's patient, 55-year-old Brad, had a mountain bike accident and fractured his neck.
Are they like shock waves down your arms, or is it just like tingling, like ants?
No, it's like stings.
Like stings.
CT scans revealed a teardrop fracture in his upper neck.
Worry is when you have a fracture that pushes back into that canal where the spinal cord is, and I can't see anything doing that.
I'm actually thinking that he's been lucky, because I think he will have a good outcome.
It's been 8 weeks since the father of two's accident.
Between the accident and getting to the hospital, my worst fear was some form of paraplegic or quadriplegic or something.
The former Ironman didn't require surgery, but wore a neck brace for 6 weeks.
Whilst everybody was sort of reiterating that I was very lucky in my outcome, the restriction of the collar and that was very, dare I say, depressing.
But things look much better now that he has the okay to get back on his bike.
Getting on the bike is amazing. I'm back positive and really looking forward to the future and looking forward to setting new goals and achievements and really grabbing everything I can now. Sometimes we, might sit back and think, oh, yeah, I'll do that tomorrow. Well, yeah, nah, I'll do that today.